Hey there, it's Christine Glazeman with Storehouse Insurance Services, and today we're going to talk about frequently asked questions for about Medicare plans for people who are still working. So I have about 5 questions that I commonly get asked when people are they're turning age 65, but they're planning on continuing to work, and they want to know how it will affect them if they go on to a Medicare plan as opposed to staying on their employer-sponsored plan. So the first question is, do I have to retire to enroll in a Medicare plan? And the answer is no. You can continue to work and still have a Medicare plan. You would just come off of your employer's group plan and come on to a Medicare plan. So when you eventually do retire, your Medicare plan benefits should stay the same. But if your employer has a different arrangement for cost sharing for retirees' premiums, then you're going to want to work closely with your human resources manager to find out what that cost arrangement would be. So how much can I potentially save by coming off of my employer's plan? So the average cost of an employer-sponsored plan for someone age 65 in California is about $1,400 per month. Now, if you add on a spouse to that same plan, that's close to $3,000 a month. Most employees are not seeing the total cost of the plan because their employer is sponsoring part of their premiums. So let's say, for example, if we have someone age 65 and their employer is paying 100% of their premiums but nothing for the spouse, then they would end up paying about $1,400 per month for their spouse. If the employer pays 50% of the plan, well, if you do the math on that, it's about $750. So the employee's portion would be $750 plus the cost of whatever a spouse would be. So the average cost for an upper end Medicare plan that has the largest doctor networks is between $300 and $400 a month. So you do the math on that, it's pretty substantial savings. You'll definitely want to work with your insurance agent to find out and determine exactly what those cost savings will be before you make any decisions about coming off of your employer-sponsored plan. Next question, would there be any reason to stay on my group plan? And I would say the only reason to stay on a group plan could be a really special circumstance, like a need for expensive brand name medications. In some state and county plans, sometimes they do offer a little bit better coverage on the really expensive brand name medications than the standard Medicare coverage. But the only way that you're going to know that is to do an individual comparison, and you're going to want to work with your insurance agent who has knowledge on how to compare the costs for those drugs before deciding to move. But if the employee does not have a need for expensive brand name medications, the savings can be really substantial. Number 4, can I return to my employer's plan if I don't like the new Medicare plan? And I would say in most cases, yes, you can return to your company's plan at their renewal time. It's always good, though, to verify first with your human resources manager to make sure that you can, in fact, return to your group plan. And so you're also going to want to really work closely with your insurance agent when implementing this kind of change, coming off of Medicare, going back to your group plan. Because your agent's going to be able to really make sure that this is in fact the best option for you, and they're going to help you coordinate the changes when one plan cancels and then the next plan is effective, so you don't have a gap in coverage. Number 4, can I see my same doctors if I enroll in a Medicare plan? And I'm going to say with certain plans, yes. As long as the doctor accepts Medicare, you can continue to see your doctor. Now, this goes for Medicare supplement plans. There are other types of Medicare plans that this is not the case. You're going to want to work closely with your insurance agent to make sure that you're enrolling in the plan that your doctors are in fact in network. And next, what about, this is the last question, guys, what about dental and vision? A lot of employers will allow their employees who come off of the group medical to continue with their dental and vision benefits, whether they continue to work or they retire. Again, you're going to want to confirm that with your human resources manager. And if your company does not offer dental and vision, you can also work with your insurance agent and they can provide you quotes for individual dental plans. So I hope this video was helpful for you guys. If you have any questions, please send me a message. And if you'd like to speak with me, if you have more questions and want to determine if coming off of your employer plan would be a good fit for you, if it could save you some money, then go ahead and click the link below, and it's also in the description to schedule a 10-minute phone call with me. Thanks, guys.